We are in a full swing of our season 4, running into September 2025. If you just found us, we have over 50 episodes for you to explore. You don't need to listen to them all in sequence. You can look them up and choose a la carte topics and issues that most interest you. I promise you will want to hear them all. Season 5 coming up in October 2025. Welcome to the Global Health Matters podcast. I'm your host, Garry Aslanyan. We have reached the end of our 4th season. If you just found us, we have over 50 episodes for you to explore. Choose the topics that most interest you, yet I promise you will want to hear them all. If you haven't yet, follow or subscribe wherever you get your podcasts so new episodes land straight into your feed. Season 5 is launching on October 12, 2025 at the World Health Summit in Berlin with our first live recording. If you are in Berlin, be sure to come and say hi. The episode will also be streamed on our YouTube channel. For our final episode of this season, we turn our attention to one of the vital questions of our time. How do we ensure the health and well-being of our children in a changing world? For that, I'm joined by two distinguished leaders in global child health, Landry Tsague and Debra Jackson. Landry is the director of the Africa CDC's Center for Primary Health Care. He has also held senior roles at UNICEF and is the co-founder of the Pan-African Medical Journal. Debra is the Takeda Chair in Global Child Health at the London School of Hygiene and Tropical Medicine and an extraordinary professor at the School of Public Health at the University of Western Cape in South Africa. Together, Landry and Debra help us reflect on the remarkable progress made in child health over the past decade, the pressing new challenges that lie ahead, and the strategies needed to secure a healthier future for the world's children. Hi, Debra. Hi, Landry. How are you today?
Great. Happy to be here.
Happy to have us today.
So let's get started. So it's an extremely important conversation we need to have. In preparation for this, I read a report highlighting that we actually made significant progress in child health. If you look at the last 35 years since 1990, and global under 5 mortality has fallen by over 60%. And of course, vaccination programs have reached historical high coverage nowadays. What do you see, Landry? Let's get started with you as the most critical drivers behind this remarkable progress. In your case, you're in Africa and, of course, in other countries as well.
Thank you so much, Garry. We need to acknowledge the progress that was accomplished, especially around child mortality reduction and child survival. As you mentioned, we recorded unprecedented gains over the past 2 decades. I think we want to highlight here some of the key factors that we have recorded in those countries. Beside the fact that most of those countries have recorded significant allocation of resources, domestic resources, particularly towards public health. If you look at countries in Northern Africa, where the reduction happened earlier and has been sustained, you will definitely understand that domestic allocation to primary health care has been a significant driver. Now, if you move southern on the continent, what has made the difference if you look at countries like Rwanda, Ethiopia, Senegal, Ghana, Tanzania, even Kenya, there has been a critical investment in primary health care, particularly community-based primary health care. And I think we want to highlight the significant impact that community health work have had in those countries. And they have been instrumental in bringing those high impact interventions, immunization, nutrition, maternal care to the most underserved population.
Debra, from your perspective, does this progress inspire hope or warrant cautious optimism?
I think prior to 2020, I would have said hope and optimism. We were very excited about what we were seeing. But since COVID-19, and as we're seeing in the last 5 years, the increasing impacts of climate change and conflict, I would say there's now serious concern that these gains will be lost. In fact, in a recent analysis that LSHTM did for a climate and child health white paper, we showed that even with the best case scenario of climate, which is 1.5 degree warming, that most projects projected would be undermined by the continued warming. You'd still see improvements, but much less than you might have had been seeing. Whereas if we move to 2.5 degree warming, the mortality and preterm birth, those sorts of things, they're going to rise significantly, swamping all the advances that we've made to bring death rates down. And I think what's very discouraging is that as of last year, 2024, we reached or exceeded the 1.5 degree target, according to the global estimates. So I think there's still optimism, but we have to address emerging challenges and take those into account if we're going to maintain those reductions.
Despite all of this good work or some cautious optimism or maybe a bit of worry in terms of climate, we, of course, still have 4.8 million children globally dying. And that was in 2023, the data we have. And nearly half of these occurring in the first month of life. So this is a critical period. Today, we'll discuss maybe 3 major challenges hindering child health and well-being, such as conflict, you mentioned already, climate, and of course, capital. Landry, let's delve deeper into how conflict shapes childhood. And in regions we see it from Gaza to South Sudan, children are coming of age amid violence, trauma, and shattered infrastructure around them. What are the immediate and long-term consequences for a generation raised under such conditions?
Garry, we want to also highlight the fact that we have to be very cautious because those gains are also being threatened by the crisis, and especially insecurity that is protracted in most of areas of our continent, being the Eastern DRC, the Sahel region, Sudan. We need to highlight that those areas are pockets where if we do not bring peace and sustain peace, we continue to have high risk children who will continue to be far from high impact prevention and care services. And just coming back to your concern on the impact of conflict and this crisis on children, I think children definitely are going to continue to be the first to suffer in situations of conflict. They are the one who become orphan. They are the one who will most likely be deprived from basic services, nutrition, immunization, and also they are going to be the one at risk of diseases linked to lack of safe water, like diarrhea, and most likely to die because of lack of services. I think we also underestimate the mental health due to protracted situation of conflict that adolescents, especially growing situation of conflict, will suffer. And I think if we want to provide that environment, we need to bring peace. We need to invest into peace, especially in Africa, as part of a comprehensive approach or multi-sectoral approach.
Debra, anything to add for that?
I think, as Landry mentioned, the well-being. If we look at threats, particularly in the under 5 and then again in the adolescents, that's when the brain is growing. That's when the brain is developing. Those are the rapid periods when you start to look at a life course approach. And we know that stress or critical events in those periods of a child's life can really change the brain growth and their emotional as well as development. And so protecting children as much as we can in these environments and having programs to address that stress is really important.
And as part of our approach to primary health care, Africa CDC, we do not only advocate for primary health care to be prioritized as a priority system for investment. We are also advocating for primary health care that ensure continuity of services, particularly in situations of crisis or emergency, or in this case, conflict. And at Africa CDC, we support, as part of our emergency response team, the deployment of the African Volunteer Health Corps, and also the involvement of community health workers in response to emergency. Because in situation of emergency, you want to ensure that children continue to receive a comprehensive package of immunization, nutrition, because they are the most vulnerable in those situations. We need to ensure that continuity of services is preserved.
Let's go back to the climate change issue. Debra, you already spoke to that, and clearly it poses a severe threat. We've digged out a report that UNICEF that estimates that half of the world's children live in areas facing extreme climate risks and raising temperatures. So can you tell us what are the direct and indirect health consequences for children in Africa, let's say, in this case?
This is really important. So the first one is temperature extremes. Mostly we think of heat, but you can also have increased cold extremes. But mostly we think about the heat because it's been in summer in Europe and North Africa, and all we think about is how hot it is and how much hotter it is than it has been. And what we know is that high temperature, in particular, impacts pregnancy and increases preterm birth substantially, anywhere from about 8% to 26% increases in premature birth, which then, of course, have lifelong consequences for that child, and also increases mortality, particularly the neonatal mortality that you mentioned earlier, Garry. So that's really critical. Also, rising sea levels and salination. The Pacific Island and island states, they're really struggling. And there's lots of concerns for future as that, they might lose their entire island. And then you're going to have climate migrants. As we've seen in Texas, as we saw last year in Spain, floods, which devastate infrastructure completely. And then drought, where we're seeing, and Landry, I'm sure, can speak more about drought in sub-Saharan Africa, but also in South Asia. And so both of those. Both come and they're like one end of the other, but they're both really a problem for infrastructure. Then windstorms and wildfires. So wildfires in California, wildfires in Europe now. We see them certainly where I live in South Africa. And so once again, it's the destruction of infrastructure and people's homes, people's crops, people's, the health facilities, that sort of thing. And finally, ambient air pollution. Now, air pollution's a bit different, but very important because basically the carbon emissions that are causing climate change are also cause increased air pollution. And then also when you're talking about wildfires, clearly increases ambient air pollution, and that temperature extremes, particularly heat and air pollution, can often go together. So those are your direct effects that we have to prepare for, both in communities and in our health facilities, to ensure access during and after any of these extreme events. But there are also indirect threats to livelihoods and human rights. When we talk about loss of homes, loss of fields, loss of job sites are going to be threats. We see displacement and migration. There are lots of climate migrants. A lot of the people we see moving within Africa are because they can't grow food where they are and they need to move someplace else. And then the weakened health systems and infrastructure, which then aren't there to help the communities. And then impacts on food and water systems. UNICEF's written a lot about the impact on water and clean water, and I think Landry mentioned diarrhea, and then food. So we see increases in malnutrition, increases in diarrhea, mortality, that sort of thing. And another one that a lot of people talk about is climate-sensitive diseases, in this case, infectious and vector-borne diseases, neglected tropical diseases, which TDR takes on. But you're talking about malaria, you're talking about Zika, yellow fever, dengue. And these are happening even in Europe, where sandflies carry leishmaniasis. And what you're seeing is that the areas that are warm enough for those vectors are expanding. And even in the places that they already have it, the length of the season that supports those vectors is longer. And so that's a real concern. And finally, the exacerbation of social determinants and inequalities, so that we know that the most vulnerable are always hit the hardest by any of these things, whether it's conflict or climate. But these things also create more vulnerability. We know that during extreme heat, we've got very good data on extreme heat that we see increased gender-based violence. That post floods or drought, when you've got destruction of infrastructure, that you see more child marriage, you see and more gender-based violence. So I think it's really impacting, our social structures and our physical structures, and of course, mental health, because the stress of it across the board is difficult for children and their families.
I think, Gary, just on this one, the biggest challenge today from a system perspective, if you look at the way primary health care on the continent has been designed over the years, and what the heavy trends that we have to face today, I think we are definitely going to draw down to how do we invest from a whole of government or whole of community approach into social systems that are climate sensitive? And how do we design also community-based strategies that will allow us to have early warning? Because at the end of the day, climate events, we need to detect them early and activate our response mechanism.
Landry, you mentioned obviously that more is needed to be done in preparing, and that will cost. But obviously, we also have a situation where coping with these funding cuts you've alluded to in the very beginning. So, in your discussion with different leadership and different governments that you work with, how are things going, and have there been any unexpected innovations that may have come up?
Oh, Gary, I think this is an ongoing situation. And as you know, over the past 4 years, if you compare 2021 to 2025, the official development assistance towards health on the continent, we have recorded a 70% decline. And most of our member states on the continent were not fully prepared to cope with it. But it is what it is. And the head of states of our continent under the African Union stood up to the challenge. And the champion of domestic financing, His Excellency President Paul Kagame, President of Rwanda, and his peers, brought together key stakeholders last February to design what is now a blueprint on how we should, on the continent should redefine or reinvent health financing in this new era. We are really in the new era, an era where, as a continent, we still continue to face high burden on infectious diseases. Debra mentioned the multiplier effect of climate change and conflict. I think Africa CDC recorded between 2022 and 2025 for 41% increase in the number of public health events. But what is critical, Gary, to highlight here is that while our member states are taking charge,
Right.
they are clearly articulated the direction of travel. They articulated 3 critical areas where we should explore and mobilize innovative financing or domestic financing for health on the continent. The first area is through domestic budget. I think we all are advocating for member states to achieve the 50% Abuja Declaration target or to go beyond. At the moment, we have recorded about 3 member states, and definitely there's a clear call to action to start by looking at our domestic resources.
Right.
But on the other hand, this domestic resource is constrained by what we all know around the debt servicing, which continue to siphon close to 61 billion of our, let's say, overall domestic, let's say, GDP of the continent. So that's first source of, let's say, domestic or innovative financing for health is constrained. Let's acknowledge that. The second track that our head of state have recommended that we pursue is the area of innovative financing. And this is a space where it's about looking at solidarity funds to support through levies either through importation of goods, levies through airline tickets, or levies on the sin tax, levies on alcohol and commodities. And on this innovative financing, there's one that we have not yet tapped, significant again. It's what we are calling the diaspora remittance. Do you know that annually the continent receives close to $95 billion in diaspora remittance? But that option of innovative financing can be, channeled towards some type of spending in the health sector. There's a third area of innovative approach that our head of state have endorsed, which is now the blended finance.
Okay.
The blended financing is that modality that will be attracted through the private sector to support much more structural changes, like infrastructure for primary health care, digitalization, local manufacturing of vaccines, therapeutics, and diagnostics. And beyond that, what is going on now, because those three tracks may take time to be achieved. But what's going on now is definitely working towards efficiency gains, doing more with what we have. We don't allow the narrative of doing more with less. I think what we have, we can do more with what we have. So fostering integration of services, increasing our efficiency, reducing those logistic and transaction costs by leveraging approaches like digital health.
Debra, do you have any reflections on the impact some of these financial situations might have on children on the continent in this case?
Yeah, I mean, obviously, we are in the short term, we're seeing reduced availability of commodities like HIV treatment, contraceptives, vaccines, along with closing of health facilities and reduction of health workforce. And that, as always, children are there, they're the most vulnerable, they're going to be impacted first by any crisis, financial or climate or conflict. So we might expect to see increases in both child morbidity and mortality. And that, I think for me, another concern is that once you stop these health programs and these building blocks of a health system, it's difficult and very costly to rebuild. It sounds very doomsday, I recognize, but I do think the initiatives that Landry spoke about are so important, and that we need innovation, integration, and collaboration between our national, our local, and global stakeholders to protect the health well-being of the vulnerable. So that as we look at those budgets need to address children, they need to address vulnerable populations. And the greatest impacts can be achieved by getting the resources and improving access to services where the gaps are most profound. And so I think in a recent, the global strategy, it said we need to invest more in women's and children's health, adolescent health, but we also need to invest more wisely. And so that means, addressing the vulnerability, the most vulnerable, where you're going to get your best bang for your buck, as they often say.
Mm-hmm. Yeah, so you already spoke to this in terms of, really, it's not only money, it's also how things need to be done, right? So we've covered some of the issues. We've looked at really the underlying challenges, and all of those are still with us. If we were to look into the future a little bit and spend a bit of last part of this conversation to see how to build on this conversation, to see how can children be thriving, and not just in their health, but also in terms of their autonomy, relationships, learning, education. Can I hear from both of you on this? Maybe we can start with Debra. What changes are needed in our approaches and strategies to promote more holistic health and well-being of children within their unique contexts, rather than looking at children as, this is with disease and this is the other disease and this is the other vaccination and all of that. Can you take us there?
I spoke briefly earlier about a life course approach, understanding that what happens early and ongoing impacts the child and the family and the future community. So we have to worry about their health, social, economic, environmental factors at all stages of life, from infancy to adulthood. And we have to worry about equitable health and well-being for all. Two really key pieces, I think, are integration of services, because by integrating, you're going to increase efficiency on comprehensive integrated primary health care, rather than vertical programs, which often lead to duplication, inefficiencies of financing. I think the other thing we really need, and which linked to what I was saying before, is funding for information systems. Information systems are often seen as extra, not as core to our work in health. And when funding is tight, maybe that's one of the things that goes. And it really is core. And we need to think of it that way. And we need to convince our governments and policymakers that, particularly when we're talking about vulnerable populations, the investments in data collection can target an actionable use at the local level to know, where do we send those vaccines? Where do we need the HIV meds? We don't need them everywhere. We need them in certain places. Information systems will help us to target our interventions. And so making sure that you're sending your resources and building your infrastructure in the right place to make sure you're getting the right people. And so I think information systems are going to be critical if we're going to address this.
Landry, maybe we can hear from you, particularly because you are now in this role of being the director of primary healthcare at Africa CDC. I don't even know where I start to imagine how busy that sounds, of course. But I'm sure you've had some thinking around new approaches or strategies that are needed in delivering primary healthcare or primary care to African children in more holistic, integrated, and culturally relevant way. Where are you thinking, and where are future plans for you, Landry?
Thank you so much, Gary. Let me take a step back to touch on some of the critical determinants. I think we need to put things in context here. The continent needs peace for all its children. And without peace, there is no health. I think during this conversation, we articulated the impact of conflict on the child well-being on the continent. The second point or heavy threat that we have observed through a recent study done by UNICEF looking at immunization data over the past 20 years across the continent. Besides conflict, the other determinants of good and sustained immunization coverage was economic development. And I think economic development is very much connected to the whole conversation we're having about domestic resource allocation to health. The higher your DDP and the higher your allocation to the health sector, the more likely, if it's child-sensitive budgeting, the more likely you are going to invest on the right interventions, and you are going to invest on the approaches that Debra also described. And the third factor was good governance. I think that study also highlighted that good governance was a heavy trend at continental level, looking at our 55 member states. It may be beyond the mandate of Africa CDC, but that's the evidence coming from the data. And we're working with the African Union and the head of state to ensure that as part of the Lusaka agenda, which is an agenda of health sovereignty on the continent, we look at the conditions that are needed to create that primary health care system that is not only domestically funded, it's a system that will ensure universal health coverage primarily to the most vulnerable, in this case, our children. It's a system that will also provide the caution in case of threats or in case of epidemic. A system that is, in this case, epidemic and pandemic ready. I think that's the vision at Africa CDC, and that's also a vision that will allow us to create an environment where our children will not only survive, they will also thrive, and they will express their full potential.
In the last couple of months, even, I've heard that there were several new promising treatments or approaches to, let's say, malaria or new pediatric formulations for schistosomiasis. If you were to use this approach, what strategies would you recommend to ensure that these interventions are implemented in a way that supports this integrated child-centered care? What would you do when you were introducing this? Because we're going to see some of this coming the way, and if they're not applied correctly, we may end up in the same place. Maybe, Debra, you can start, and then Landry.
For me, two critical things. One we haven't mentioned, and one we have. Implementation research, implementation science, and community engagement, I think, are really two things that we need. Programs need to be co-created at the national and local levels to assure they meet the needs of our children and the families, and that they're context specific. We often know what works, but we don't translate this into implementation on the ground. And so we must work with the health managers, healthcare workers, and the communities so that these important innovations actually get to where they're needed. They actually get to the children or the families. To do that, you need to look at implementation research, implementation science. You have to talk to them about their local challenges. Even within countries, you've got differences. It's never one size fits all. And so you've got to look at those differences. And the only way you're going to understand those differences is by working with those communities and working with those local health facilities.
I think, Garry, what Debra touched on is so important. We need evidence-based programming from our local research. I think local research is going to be more and more critical. But let me highlight 3 points here. The first one is what Africa CDC sees as the top priorities in this context of new innovation. The first one is local manufacturing. I think we have learned from the COVID era that, and our head of state have given that clear mandate that the continent should produce and procure or utilize by 2040 60% of the vaccines locally. And this means that local manufacturing has already taken the top priority on the agenda of the continent. Linked to that is the digital transformation. I think primary health care transformation has put a heavy emphasis on infrastructure and digital transformation if we want to achieve that climate resilient and that epidemic-ready primary health care. And the third area, Garry, that we need to highlight, which will have a huge impact on our children, is the whole critical area of preparedness, pandemic preparedness and response. I think if you look at the new pandemic treaty, and the whole needs to have access to benefit when we are facing a new threat. It's going to be critical because our children are, in most cases, the most affected in case of new outbreaks.
Thank you for that. And I hope that we can wrap up by both of you maybe giving us a little bit of future game-changing outlook, if you can. So our listeners who are working in different parts, both in Africa and other parts of the world and global health, can also get inspired. So maybe, Debra, what are your parting words?
Once again, I think communities are key, and I'd love to give a positive example at the end of all this. We're working on our High Horizons project, which looks at heat impacts on mothers, newborns, and children, and we're working in Kenya, Zimbabwe, and South Africa. In Zimbabwe, we're working in an area called Mount Darwin, very rural, very hot, and Landry mentioned early warning systems. And so we were developing an app, what we call Mother Heat, which then would warn the community health workers, the community, the facility health workers, and the mothers. It's going to be hot. You're going to expect extreme temperatures in the next 3 days or whatever. But we don't want to just tell them. We wanted to help them understand what to do to protect themselves and their families. But we wanted that to be locally generated information. We didn't want to just tell them what to do. Oh, go drink more water or wear light clothes or whatever. We wanted to engage the community in that. And so what we did is we gave moms, pregnant women and postpartum women, cameras, low phone cameras, and talked to them about recording their lived experience of heat while pregnant or with a new child. That seems like the simple part, but the more exciting part was, as part of that, the mothers all curated a poster of what they saw, and they had a huge community event where the mothers stood next to their posters and the community walked around and the mothers talked about their stories. And so it was not only the mothers who were learning about this, they were then becoming advocates and telling the community about the issues around heat. And then after that, they had community meetings to talk about what they were going to do about it. And I think that emerges as its own thing, without us. And it was very exciting kind of an idea. And so I think that's where communities will take these things on when they understand. And there are different ways to do that. And I think that these are really exciting examples that are relevant no matter where you are, that you work with these communities and the mothers, and they're there to protect their families and their children.
Landry?
I can't be optimistic without highlighting the strength that the continent has in its young people. I think the workforce gap that we are facing on the continent today, in the health sector particularly, can be significantly reduced if we invest in our young people. I think they are tech savvy. This is a tech savvy generation. The continent is planning to have 2 million community health workers by 2030. We have now reached half point. So I think the young people can definitely make a difference in what we are calling the community-based primary health care. Within their community, they can be agent of change. They can be the champion for child survival. They can be the one to reach that child who is missing his immunization. They can be the one deployed as part of the first responders in case of climate threat or emergency. The second point I really want to highlight is the financing. We are at the beginning of an era where we are seeing definitely our member states, the leadership of our head of state, being illustrated through increased allocation of domestic resources towards the health sector. We're going to see more and more innovative financing. I mentioned that the diaspora remittance is definitely an area where we haven't tapped into enough. And African Union consider the diaspora of the 50 member state or region. And definitely we have a long way to go also around the blended financing, which will definitely attract the private sector to look at the 1.4 billion people of our continent. It's a market where they should invest if they really want to get higher return on their investment.
Thank you for this interesting conversation on a very big challenge, a lot of work ahead. So thanks for your insights on this, and good luck with all of your plans and endeavors.
Thank you for having us.
Thank you, Garry.
As you've heard, Debra and Landry shared powerful perspectives on child health in a rapidly changing world. First, I was impressed by the solid foundation built through investments in primary and community-based care, efforts that have saved millions of young lives. Second, I am reminded of how fragile those gains are and how three forces, conflict, climate change, and shrinking health budgets, threaten children's survival and place immense strain on health systems. And finally, I'm encouraged by the examples of community-led solutions and innovative financing strategies that can help meet these challenges and ensure the next generation not only survives, but thrives. With that, let's hear from one of our listeners.
Hey, Garry. My name's Jorge Mendez. I'm a Master's of Public Health student in International Health Development at Nagasaki University in Japan. I've been listening to your show for quite some time now. I think a lot of the topics that we often cover in public health and in global health can be quite technical, boring, and inaccessible, especially for people who aren't in our field. Because of this, I think what you're doing is so important, making these topics accessible and entertaining for all kinds of audiences. If I can suggest a future topic, I would love to hear more from professionals who are currently working on combating misinformation and disinformation in health. I think it's a really important and relevant topic, especially in today's social and political climate. Love what you've been doing with the show. Keep up the good work and have a great day.
Jorge, I'm so glad you found value in topics we explored in Season 4. Thank you for your recommendations for future episodes. And to all of our listeners, thank you for your continuing support. I love to hear your ideas for upcoming topics. So keep an eye on our social media for details on how to share your suggestions for Season 5. To learn more about the topic discussed in this episode, visit the episode's webpage where you will find additional readings, show notes, and translations. Don't forget to get in touch with us via social media, email, or by sharing a voice message. And be sure to subscribe or follow us wherever you get your podcasts. Global Health Matters is produced by TDR, a United Nations co-sponsored research program based at the World Health Organization. Thank you for listening.